Hey there, Anatomy Super Friends. I'm Dr. Blake Martin from drblake.ca here with another Anatomy Quick Bit. And today we're going to have a clinical focus on Piriformis Syndrome, particularly looking at manual therapy. Piriformis Syndrome results from a compression of the sciatic nerve, which runs underneath or through the piriformis muscle, when the piriformis muscle becomes overused or over tight. We have here three different sciatic nerves covered by three different piriformis muscles, so we can discuss three possible different treatment options. A very popular form of self-care is to use a massage ball and roll on top of it in the affected area. The problem with this particular form of self-care, particularly in Piriformis Syndrome, is that rolling on the ball will roll on the piriformis muscle, but also directly onto the sciatic nerve. And the pressure will be then transferred directly to the sciatic nerve, compressing it downward. A second form of care is to directly manipulate the piriformis muscle with massage. The problem is that frequently a massage practitioner will press directly into the belly of the muscle, thereby compressing the muscle and reflexively compressing the sciatic nerve underneath. I learned that you should massage toward either end of the muscle, either towards the trochanteric end or the sacral end, and that way you'll be more likely to miss the sciatic nerve. The problem is it's difficult to tell exactly where the sciatic nerve lies underneath the muscle. A third form of care suggested by sciatica.org is to realize that you do want to stretch the muscle, but you don't want to compress the sciatic nerve. In that case, you press your thumbs along the lower border of the muscle and press it in an arc upwards, sliding it over top of the sciatic nerve rather than compressing it downward onto the sciatic nerve. On our clients, the piriformis muscle lies between the sacrum and the greater trochanter. I'm going to remove the gluteus maximus muscle here on mini Oscars so I can show you. If you locate the posterior inferior iliac spine and the greater trochanter, you have a rough idea of the direction and line of the piriformis muscle. Laying your fingers along the sacrum and your other finger across on the greater trochanter, you can press across and feel the inferior border of the piriformis muscle. Unfortunately, in most people, we can't remove and replace the gluteus maximus at will, so we have to locate the piriformis muscle underneath. This is done by feeling sensitively along that line and sensing where you feel that dense band of muscular tissue. The gluteus maximus at this point is about 2 centimeters thick. Your job as a practitioner is to push the piriformis muscle upward toward the client's own shoulder on the same side. Recent research suggests that a very long stretch, anywhere from 5 to 15 minutes, is most effective. However, it's possible that your client may not want you to press onto their buttocks for 15 minutes, and you might not want to press onto their buttocks for 15 minutes. In any event, a persistent, long, upward stretch along the inferior border of the piriformis muscle is going to be most effective. It's also very important to avoid pressing directly downward onto the piriformis, which will then in turn press onto the sciatic nerve. This is one of the reasons why self-care can be very important. Stretching and strengthening the muscle, where directed by a physician or qualified healthcare provider, can provide great relief in these instances. This has been an Anatomy Quick Bit. I'm Dr. Blake Martin.
Bro, so much tape. Can't even lift.